right, I'm back. Part two. Part two, people. Respiratory sounds. When you go to the doctor, usually what they would do is they would try and tell you, okay, breathe in and out, breathe in and out, breathe in deep, and then exhale deep, okay? And usually what they do is they use a stethoscope. Okay. Now the reason why they do that is because they want to listen to the respiratory sounds in your lungs. You have two types, okay, and they can hear this. They are trained to listen to this, okay. First off, you have the bronchial sounds, okay. The bronchial sounds is the sound of air that is passing through your trachea and your bronchi. Okay, and then vesicular breathing sounds, okay, they are soft sounds that you can hear when air is filling up the alveoli. Okay, so that means bronchial sounds are louder compared to vesicular breathing sounds. All right, because for the trachea and bronchi, there's a huge amount of air that's coming in on those huge tubes. Unlike the alveoli, they're so tiny, there are just soft sounds produced. Okay, now we talked about internal and external respiration. Okay, so now what happens when we have external respiration? First off, you have what we call oxygen loading into the blood. That means oxygen is put into your blood. Now here's the thing, your alveoli, no matter what happens, your alveoli will always have more oxygen than your blood. Okay? And the reason why oxygen moves towards the blood is because it goes through diffusion, where oxygen would move towards where there's a lower concentration. Now, since blood has lower concentration of oxygen, the tendency is the oxygen from the alveoli would move to the blood. Okay, so pulmonary capillary blood, that means that's the blood that came straight from your right ventricle, okay, that right side of your heart, that is the one that gains oxygen. All right, now carbon dioxide during external respiration is now unloaded. Okay, that means the carbon dioxide on your blood is being taken out. Now again, we have diffusion. So take note of this. Your blood has more carbon dioxide compared to the alveoli. So as a result, the carbon dioxide would diffuse because the carbon dioxide wants to go where there's lower concentration. And so the carbon dioxide would move from your blood to the alveoli. Okay, so now instead of the blood gaining the carbon dioxide, the blood is actually not, you cannot gain, it will only take carbon away and it puts it to your lungs, and that carbon dioxide is what you exhale out. Okay, so that means during external respiration, blood leaving the lungs will always be oxygen rich and at the same time carbon dioxide poor. Okay, so take note, this is during external respiration. Okay, now this is how it works. Okay, it's pretty much the explanation I did. Okay, if you want the picture, that's fine, it's in your books. Okay, now gas transport in the blood. What exactly happens when gas is being transported in the blood? Let's talk about how oxygen is transported in your blood. First off, the oxygen would travel with your blood when it is attached to what we call the hemoglobin. Okay, we've talked about this on chapter 11. Okay, and so that means your blood needs to have hemoglobin to be able to carry oxygen. Now, once the hemoglobin has oxygen attached to it, we change the name. It is now called oxyhemoglobin because now the hemoglobin has oxygen. Now, not all of the oxygen is carried by the blood. Okay, it's not carried by the hemoglobin. Some of them are also carried in the plasma, which is the liquid part of your blood. Okay, so that's the oxygen transport. Okay, now how about carbon dioxide? Carbon dioxide is also transported through your blood. Now, in comparison, most of the carbon dioxide in your blood is in your plasma. Okay, and it doesn't come up, it's not in the form of carbon dioxide. It is in the form of bicarbonate ion. Ion right here. Okay, that's a bicarbonate ion. Now, the hemoglobin can also carry carbon dioxide, but its binding sites are different from those of the oxygen. Okay, so that means your hemoglobin can carry oxygen and carbon dioxide, but the place where they are attached is different from each other. Okay, now for carbon dioxide to be able to diffuse out, that means it needs to move out from the blood towards the alveoli, it must be released from its bicarbonate form. That means it cannot be in the bicarbonate form. So here's how it works. As soon as the tissues release that carbon dioxide will be changed to bicarbonate ions and it will enter the red blood cells. Okay, so now your red blood cells contains the bicarbonate ions. Now, at some point, that bicarbonate ion will be combining with hydrogen ion, therefore producing carbonic acid. Okay, so instead of bicarbonate ion, which has a negative right here and only has one hydrogen, that hydrogen right here is added and produces a carbonic acid. Okay, now carbonic acid would tend to split to form water and carbon dioxide, and voila, there is your carbon dioxide, which is diffused from your blood into the alveoli. So that means during diffusion, it is not the bicarbonate ion that is being transferred. It is actually the carbon dioxide produced from splitting of the carbonic acid. So take note of these steps. I may ask you this during exam, so please take note and don't forget how it works. Okay? Now, we talked about external respiration. That means we're breathing in the air. Okay? How about internal respiration? How are gases being transferred from the tissue towards the blood? Okay? So, again, internal respiration is when gases is exchanged between blood and body cells. This is not the blood in the lungs. This is blood and body cells. Now, during this situation, it's opposite reaction to what happens to the lungs. Okay? So what happens is the carbon dioxide is the one that diffuses to the blood. Okay? That means in this situation, during internal respiration, the blood has less concentration of carbon dioxide. Okay? And so, the tissue would then tend to diffuse from higher concentration to lower concentration, and so the blood is loaded up with carbon dioxide. As for oxygen, blood has more oxygen compared to the tissue. So as a result, higher concentration to lower concentration. Okay, blood would release the oxygen and unload it and give it to the tissues. So that's the process of internal respiration. Again, it is the complete opposite of what happens to the lungs. Okay? Now, okay, I don't need that. Okay, so that's pretty much how respiration works. Now, what controls respiration? What causes you to breathe in and out? Okay? Of course, based on our study about the nervous system, we know that the brain controls our breathing. Okay? It is controlled by two nerves, the phrenic and the intercostal nerves. Okay? Please take note of those two nerves. Now, neural centers control the rate of breathing and how deep you breathe. And these control centers or neural centers are located in two parts. It's found in the medulla of your brain and found in the pons of your brain. Okay? So the medulla controls the basic rhythm of breathing that you have. And this rhythm is controlled by a pacemaker. Okay? And this pacemaker, this is not the pacemaker the same as your heartbeat. No, this is different. This sets up for breathing. Okay? And this is called the self-exciting inspiratory center. As for the pons, it appears to smooth out respiratory rate. Okay? So it's not going to be ragged. It's smoothing it out. Okay, so when you breathe, it's not no, it's smooth. Okay, yeah. So the pons controls that. Sorry if I made weird breathing sounds. That's weird. Okay. Anyway, normal respiratory rate or eupnea. Okay, apnea. I don't know how. I cannot remember how to pronounce that. You can research that on Google. Okay, normal respiration is between 12 to 15 respirations per minute. However, if you increase your rate more than this, then we tend to have what we call hyperpnea. Hyperpnea is when you breathe too fast because now you need extra oxygen. Okay, this is why it happens. Now, let's see. There's multiple things. There are multiple factors that can cause you to breathe many times in a minute and breathe deeper. Oh, okay, or shallower. Now, these are non-neural factors. That means this is not controlled by your, well, sort of controlled by your brain, but this one you can control it yourself. Okay, it can be voluntary. Here's an example. You have physical factors that can affect your respiratory rate and your depth. Okay, so let's say your body temperature is increased. That means your respiratory rate and depth can increase. So baby T was sick last night and she had like 100 degrees Fahrenheit fever. She was actually breathing fast, okay, because she's trying to compensate and making sure that she has enough oxygen, okay, because her body is burning up. Okay, the same thing with exercise. When you exercise, you tend to get tired. Your muscles are using a lot of oxygen, and so your respiratory rate will increase. Now, for me, I'm talking nonstop right now. If you compare my heart rate and my respiratory rate when I'm quiet compared to now, it would be different. The same thing with coughing. Okay, the reason is because when you're coughing, you use muscles, and so you need more oxygen to be able to cough. Another factor will be volition. What is volition? Volition is you just decide, oh, I feel like breathing shallow, so let's do it. Okay, that means conscious control. You can control this, whatever you want, do it. Okay, that's volition. Emotional factors. When you're depressed, you're too happy, you're crying, you're laughing, your respiratory rate and depth can also be affected. Okay? Chemical factors. Carbon dioxide levels can affect the respiratory rate and the depth of your breathing. Okay? So normally your body wants to get rid of all the carbon dioxide, but sometimes they tend to be higher than they're supposed to. This is what we call acidosis. I don't know if you remember that from the last chapter, but we call that acidosis. Acidosis is when your blood pH is acidic. Okay, so during this situation, you have high concentration of carbon dioxide in your blood. Okay, so what happens is you want to get rid of the carbon dioxide. You'll increase your rate of breathing and the depth of breathing. So you increase your oxygen intake and get rid of all of the carbon dioxide. Now, the changes in your carbon dioxide can be how would you say it? It can be detected by the medulla oblongata. Okay? Now, of course, if carbon dioxide level affects you, of course, oxygen will too. Okay? So, changes in oxygen concentration in the blood. Your blood has what we call chemoreceptors. Okay? So, these changes in concentration of oxygen can be detected by the chemoreceptors, and these receptors are found in the aorta and the common carotid artery. And once this chemoreceptors detects that it has a lot of oxygen or there's any change in oxygen concentration, the information is then sent to the medulla, which then controls your breathing. Okay? So, we're done with the second part of our lecture. We're almost done, people, so I will end this. I will come back.